Welcome to On the Line with TBR. I'm Dan Denea. Joining me today is Dr. Miguel Saldivar, Clinical Assistant Professor of Medicine at Stony Brook Medicine in the Division of Infectious Diseases. Dr. Saldivar joined Stony Brook in 2019. Dr. Saldivar is an active participant in the hospital's Hand Hygiene Committee, and since the beginning of the COVID-19 pandemic, has been involved in the Hospital Incident Command Structure's PPE preservation strategies. Dr. Saldivar holds a bachelor's degree in classical guitar performance from the University of Southern California. We'll get to that one later. He completed his medical degree at the University of Washington. He completed his internal medicine residency at New York University and a fellowship in infectious diseases at Tufts Medical Center. Dr. Saldivar is board certified in internal medicine and infectious diseases. Dr. Saldivar, thank you for the time.
Well, thank you for having me. It's a pleasure to be here.
So the first question I have is, I know there's a lot of issues around vaccinations. I know that vaccinations are very actively given through Stony Brook. Do you have any concerns, or does the infectious disease community have any concerns about the number or the percentage of people who are not signing up for a vaccine?
I think in general, what we're more concerned about is the amount of misinformation that's out there. You know, if you go on social media, if you go just on the internet, period, there's a lot of people with just spreading a lot of information that is really, frankly, sometimes inaccurate, sometimes it's well-intended, but just grabbing bits and pieces without putting together a full picture effectively. And what we're hoping to do through a number of efforts is provide the correct information, provide the more objective information so that people can make their own decision. Numbers nationwide, we're doing okay. Obviously, we can always do better, but last I had checked, we're on, I forget what the exact number was. Let me see if I have a quick count here on what the most recent numbers were, but a large number of adults, we were up to, let me see, looks like nearly 80 million, actually, roughly 80 million people within the United States that have actually completed the cycle of 2 vaccines. And then a few more with Johnson & Johnson, and I'm sure we'll talk a little bit about some of the news about the Johnson & Johnson vaccine as well.
Right, well, actually, I'll dive right into that then, since you opened the door for that. I know there's a lot of discussion. The CDC has been reviewing several cases with Johnson & Johnson. What do you know about where Johnson & Johnson stands, and what are the implications for the delay in using the Johnson & Johnson vaccine right now for providing more vaccinations?
So, the reason a red flag was raised is because there were, I believe, my knowledge is only 6 cases of cerebral venous sinus thrombosis, and it's a pretty rare condition to begin with. I think to give a little bit of a framework, there's been over 7 million doses in the US alone of Johnson & Johnson vaccine given. Only 6 cases have been reported. So the fact that the system was immediately put on hold, a couple of distinctions here. First of all, the emergency use authorization is still valid. However, both the CDC and the FDA together made the joint statement saying, let's pause this. These cases have been reported, let's be safe about it. So really, the way in which things were done reflects that the system is working, that the data is being gathered, that we're trying to catch anything that could have a hint of being a significant side effect. We're trying to catch it in the very early stages to prevent any further harm. There was an initial meeting with the vaccine committee within the CDC, the ACIP. I believe it was on the 14th, so a little over a week ago. And they did the initial analysis of the information, and they determined we don't have enough info yet. So let's continue the pause. They are meeting again today. And it is expected that today they'll make a more formal recommendation as to how to move forward. So, just to give a little bit more detail on that, the incidence of the thrombosis itself is rare enough. The specific cases that were brought to the CDC and FDA's attention had, in addition to the actual thrombosis, low platelet levels. And the combination of both of those things is what made it unusual and was raised a red flag. So it's an even more rare manifestation of a rare condition. So really, it's strictly out of an abundance of precaution. It's strictly to make sure that if there is indeed a correlation between the vaccine and this, it's caught very early on. and people are kept safe. So hopefully today we'll have more information from both of them as to what has been found, whether there indeed is a correlation, or if they don't know yet, what the recommendations are moving forward.
Are the models for coming out of the pandemic and relaxing restrictions and coming back to some level of normalcy in American life contingent or expectant on, dependent on the J&J vaccine distribution? Are there fewer overall doses of vaccine that can be delivered now because Johnson & Johnson is on this pause? And does this kind of push out some of the time frame for a return to a normal life?
I don't know the exact numbers. I think what can be said about that is there are many angles that we're looking at. Obviously, having, we have up until this point 3 vaccines that are approved. One of them being put on hold, obviously that does put on hold a few things. Thankfully, we still have 2 that work on a completely different mechanism, which actually that's also an important distinction. There have been 0 cases reported of that specific venous thrombosis on any of the other 2 vaccines, the Pfizer or the Moderna. And when I say the other 2, I mean the 2 approved in the US. As you know, there's other vaccines in other parts of the world that we are not using here. I mean, thankfully, we have 2 that are still being used widely. And hopefully we'll know soon enough whether the Johnson & Johnson will continue to be used or if there's any ongoing concern.
You mentioned earlier something I wanted to loop back to here as well. This seems like a good time. There is a lot of misinformation, you said, in social media with regard to the vaccinations, and that Stony Brook and others are probably trying to counter that. What are some of the things that you and others at Stony Brook are having to say repeatedly to encourage people to get the shot?
It's a number of things that we hear fairly frequently. Probably the more common one I personally have heard, because Pfizer and Moderna are based on mRNA technology. Everybody hears the term RNA, immediately the assumption is it's going to change my genetic code. It's going to make me into some kind of mutant or cause disease down the line. I think the first thing to understand about that is the way both of those vaccines work is, in essence, it's a set of instructions that has been given to the body's cells. The moment the instructions are delivered, the mRNA dissolves. It has no effective way of getting into the deeper structures of the cell in order to change your genetic code. So that is really not a concern. In general, the side effect profile is very good. It is well known that people get side effects, especially after the second dose, especially younger people. Fever is common. This feeling kind of crummy, basically like you're having a bad cold is common. At most, they've lasted a day. For myself, when I received my doses, I had a headache, which for me is unusual. I rarely get headaches. My wife actually had a fever, and she felt like having a bad flu for a day, and it was gone. In both of our cases, it was gone. That is probably the most common one. There's a few others that really, go more into the conspiracy theory realm of things, like is there a microchip attached to these? Is there, any other number of things? And we just have 0 information to really provide any proof that that is true. Another common concern we hear, I'm not sure where along the line, but became spread in the community. People were concerned specifically for women of childbearing age. If I want to have a child later in life, or even now, is this going to make me sterile? We have literally nothing whatsoever to suggest that. So, it's really, I think the most important part that we're trying to do is establish a conversation with the community and just provide as much of the correct information as we can. And, ultimately this is a choice. The vaccine, nobody's going to force you to get anything you don't want to get, and that's perfectly valid. We encourage you to receive it. But it is a choice, and we want people to have the right information in order to be able to make the right decision.
One of the areas that, or one of the subsets of the population that people were concerned about receiving or accepting the vaccination were the minority communities. That the Black and Brown communities in particular have a distrust of the federal government after some well-known problems regarding the Tuskegee experiment, some other issues. Is there a broader acceptance now than there was maybe a month, 2 months ago of the vaccine in some of these communities? Have there been leaders, have there been ways to communicate to all the population, to various subpopulations, but to the community as a whole, about the effectiveness and the importance of taking this vaccine?
Yeah, and that's actually a very, very important and ongoing situation right now. A couple of aspects to it. First of all, statistically, if you compare how this disease has affected minority communities, the risk of both of the severe outcomes, meaning hospitalization, intubation, and death, is almost universally higher among minority communities. That has a number of factors. It's not just the disease itself. It's also the fact that within those communities, it is more frequent to find some of the risk factors, meaning diabetes, obesity, pre-existing pulmonary disease, so on and so forth. And there's also, like you mentioned, the reluctance, just given the history of some of the past events as they have occurred. So what we have done at Stony Brook, I can't speak for the institution as a whole, because I know there's more efforts than just what I have done. What I have personally been involved with, though, is reaching out to the community. We've actually found a lot of community centers have been very ready and willing to engage in a conversation with the community. We've found places of worship to be wonderful places to have that conversation. And people gather, obviously, virtually nowadays, because gathering in a place itself would be risky by itself, but gathering virtually and just engaging in that conversation, like I said, is really providing people the correct information so that they can make the correct decision. But it is an ongoing challenge, for sure.
What about, you mentioned the vulnerable communities before. I know that there were a very well-established list of underlying medical conditions in the early stages of this that people who had those needed to be especially careful and needed to take more precautions to prevent themselves from getting this disease, and also potentially being hospitalized or suffering over a longer period of time. Has the understanding of the vulnerabilities changed at all? Are there ways to differentiate someone who has a underlying medical condition in a particular way from someone who might be further along in the spectrum, who might be even especially vulnerable? Are there, now that we've been battling this for over a year, has that list has changed at all?
It's evolved a little bit. I think the core items on the list remain very similar. And the reason they remain there is because they're so common among the community, mainly diabetes, overweight, or obesity. Those are two of probably the biggest ones. As we learn more, a few more things have been added. So folks with pre-existing lung disease, such as moderate to severe asthma, chronic obstructive pulmonary disease, or COPD, folks who have any type of defect in their immune system. So for example, people who have received a transplant and they need, as part of their treatment, immunosuppressive medications, they are going to be at higher risk. Folks who have uncontrolled HIV, same thing, they're going to be at higher risk. So the list has evolved a little bit. I think everything I have seen is kind of what you would logically expect, meaning we know baseline diabetes, obesity, etc., are higher risk factors. All the other things that I've seen added to the list, it's not surprising because they usually involve your immune system being compromised. So it would be logical that the virus would affect you more heavily.
Are there any implications for people who have some of these underlying medical conditions, who are trying to manage their underlying medical conditions perhaps even more actively than they were, to reduce the risk of COVID-19 becoming problematic for them? So, for example, are there people who battle obesity who are working harder in this context, or who are taking the battle more directly because there are underlying there is a possible risk with regard to COVID that might be higher if they remain obese, if their obesity kind of adds to the difficulty that they will face if they get COVID?
Yeah, I think it's one of the things, for example, that would be we would make it even more important for the individual to receive the vaccine. It's also another one of the items that would make it more important for them to continue with all the precautions that we've been suggesting all along, which is wearing a mask when you're in public places, avoiding crowded places. One of the things that personally worries me a little bit is, we're all sick and tired of this. We all want to go back to a sense of normal, and I'm in that group as well. Where I worry is where you go to any downtown area and restaurants are packed like there was nothing going on. I mean, I get it. I wanna be part of that, but we're not there yet. So I think folks who are dealing with pre-existing diabetes, overweight, et cetera, they need to be extra careful with that. And we are very sadly seeing some of the consequences of that in the hospital. Folks who sometimes even folks who actually received maybe the first dose of the vaccine and they don't yet have the full protection, but then they had a large gathering and they attended and they caught it there and then they end up hospitalized. So it really just emphasizes the two things. One, the importance for them to take care of themselves and to continue those precautions, but also the importance of others doing it. Another thing we hear frequently, and it's rather unfortunate, people saying, I'm young, I'm in the lower risk group, what the hell do I care? And it's if you don't do it for yourself, I get it, but do it for the 70-year-old who has to go to the grocery store because there's nobody in his household to help him get food. And it's just a mask. It's not like we're asking you to do anything out of the ordinary, really. So it just, in my mind, it just emphasizes the importance of continuing with all these precautions.
Okay. And if I know there's a lot of questions about what people, as you described, what people can do if they've had both vaccinations, if they are more than 2 weeks past the second vaccination. Is there, I've also seen guidelines that maybe offer different perspectives on this. If you've had both vaccinations and you're outside, you're in a supermarket, what sorts of practices can change once you've been fully vaccinated and your immune system presumably has had a chance to adjust to the second shot?
So the CDC has actually put together a list of all the items that they now consider safer for those who are vaccinated to do. And it's always a good idea to keep on checking on their website because the list evolves as we learn more. We relatively recently started giving the vaccinations, but we are gathering more and more information as time goes by. So for example, some of the things that they mentioned there is if your household is vaccinated and you want to visit your neighbor and your neighbor doesn't have anybody in the higher risk category among their family, you're probably okay to do so. If your household is vaccinated and there's another household that's also vaccinated, then it's also okay to visit. At that point, they suggest you may not even need wearing a mask. If you are going to be visiting somebody and your household is vaccinated, but there's somebody in that household who is, let's say, 80 years of age and they have diabetes, then you should be more careful. Then you should be wearing a mask. I think one of the big ticket items that we don't yet understand is, that we don't yet know, that we're in the process of learning, is when you receive the vaccine, we know for a fact that it protects you. We're not yet certain whether it prevents you from becoming what's called an asymptomatic carrier, meaning could you have the virus living in your body, passing it along to others, and it's just not affecting you. And that is, from the experience from older vaccines, I'm talking measles, mumps, rubella, et cetera, we're hoping that that's what it's going to do. We just don't know with certainty yet. I think at this point, really, the most important role of the vaccine at this point is that we know it prevents you from reaching the severe stages of the disease. So we have seen a few cases of people who got both doses and maybe somewhere right before the time they got the second dose, they were exposed, they developed some disease. And a lot of those folks end up getting very mild disease. And, yes, okay, you maybe you still have COVID, but you did not end up in a hospital. You did not end up intubated or, in the worst case scenario, dead. So I think the primary role of the vaccine at this point is really that, to prevent you from landing in a hospital with the severe stuff. And we're also hoping that it'll eventually prevent us from, if you're an asymptomatic carrier, or if you're exposed, just prevent you from passing it along to others, period. But going back to your original question, because that was a little bit of a tangent, another thing to consider is, let's say another question we hear frequently is, can I travel? So the CDC is saying if you are going to be traveling within the US, probably okay to do so. I would strongly encourage you to still be careful, especially at the airport, because there's quite a few people there. You're going to be, sometimes you may not be as able as you would like to keep that social distance and so on and so forth. So just make sure you do the hand washing, make sure you wear a mask. And then the airplane, most airlines, from what I've heard, have been very careful about keeping the seats separated, folks in different areas to keep the distance, so on and so forth. But it's really when you're in the airport that may be a little bit trickier, let alone if you need to take a taxi, things like that. So personally, I'm still not don't feel 100% comfortable traveling, but I know that some people have started doing so. I would just encourage everybody to be extra cautious when they do. One more aspect to this, one last thing, because the CDC did mention this, they are suggesting it is okay to travel to other countries. However, if you look at their own CDC's list of which countries are considered high risk, there's very few that are not high risk. Matter of fact, there's Greenland, Australia, and like one or two other countries. Other than that, they're all like red in the map. So just more caution is always better than the other option.
And you mentioned travel. That is something that I know there's been a lot of discussion about, because people would like to see family they haven't seen for over a year. Have you read about super spreader events on an airplane or in an airport that are connected to these places where people would go to travel?
I haven't read of any myself. I know there was one, I forget which state this took place in, but it was a large gathering, and I didn't I don't know what the numbers were as far as how many people there were vaccinated. I believe it was a low number, but there have been spreader events. I'm not aware of any specifically related to airports or to airplanes.
Okay. And in terms of the data you're looking at, are you studying, what sort of information are you looking at in the context of Suffolk County and New York, the United States, even in the world? Are you tracking any data on either a daily or a weekly basis to get your arms around what's happening? And if you are, what is the data telling you?
Yes, so in our case, obviously, since we work here in Suffolk County, and we are the major academic center for Suffolk County, we've been keeping track of the numbers here daily. There's a daily meeting, one in the morning, one in the afternoon, including weekends, and every single day we take a look. March and April of last year were by far the worst. When we were at the peak of this, we have roughly 630 beds, I want to say. That's like baseline capacity. About 440 of those were all COVID related. This was April of last year. So that's, 75% of beds. And we had it easy. If you look at some of the hospitals in the city, Elmhurst, Bellevue, they were like far worse than what we were. So compared to that, we're doing much, much, much better. We did reach a low, meaning roughly April, March were the worst, then numbers started coming down around, I would say, September of 2020. We were at approximately, to give you more or less a framework, of all the tests that were done, approximately 1% were coming back as steadily positive. Then after November, we saw another uptrend. And we've kind of been riding that wave since. Over the last 2 or 3 weeks, though, it's looked more and more encouraging. So last numbers I heard from the meeting this morning, we're in between 2 to 3% positivity, and we've been there for about a week now. Before that, we were staying pretty stable at 5 to 6 thereabouts. So it looks like finally, and this may actually be an effect of the vaccine. This is what we're hoping. The numbers are finally starting to little by little trend their way down, and we're being cautiously optimistic. We're still keeping our guard up. We still have all of our staff on high alert, but there seems to be a little bit of a light at the end of the tunnel.
That's good news, definitely. Who are the people who are being hospitalized now? Are they the people with diabetes and obesity? Who are people who are still require attention when they get COVID?
So it's actually a very, very good question, because as you can imagine, at the height of this, the worst cases were by and large the folks with the comorbidities that we mentioned, meaning overweight, diabetes, pre-existing heart disease, so on and so forth. We saw that for quite a while. We're still studying this, but right around the the people started getting their second dose of vaccine, especially, we started seeing a shift in the demographic. Suddenly, we started seeing more folks who were on the younger side and maybe not quite as severe comorbidities. We still have seen a few immunocompromised, and those cases are sort of a little bit of an outlier because of their pre-existing condition being more complex. But we definitely did see for a while an increase in cases of younger folks that before maybe we wouldn't have seen as many. Uh, we suspect that is because of the vaccinations, meaning the vaccines are doing what they're supposed to do, which is keeping the higher risk folks, um, either with no symptoms at all, or when there are symptoms, they're much milder.
So the people who are coming into the hospital, some of them are younger. When you say younger, do you actually mean in their 20s and their teens, or you mean in their 40s?
More like 40s, 50s, thereabouts. I mean, we have seen a few, like, 20s or so, but that's more uncommon. By and large, it's the younger population. When I say young, like younger, meaning like 20s and younger, it's much more uncommon. But for the last couple of months, we've seen more like 40, 50-year-olds where, like I said before, we wouldn't have seen as many of those.
Okay. And a couple of last quick questions. I know that, as I mentioned in the beginning, that you've been involved in the hospital incident command structure's PPE preservation strategies. Is there still a need to stockpile or to ensure that there is adequate PPE for the hospital? Is that an ongoing concern, or is the supply adequate for the demand right now?
So for our hospital, we've been very, very lucky. We have now reached the point where we're starting to be a little bit less worried about, I think the Achilles heel worldwide, where it was always the respirator, the N95 respirator. And especially April of last year, I mean, we were going through a lot of them, and not just us, every single hospital in the country, let alone the world. In most recent months, it's probably a combination of production as well as our acquisitions team has been amazing. And we also have, sort of a reserved stock should there be another uptick in cases. So we're doing okay. We're, again, we're not putting our guards down yet, but we're very thankful that our team has been really amazing about that, and we're in a reasonably good spot right now.
Great. And then with the hospital's hand hygiene committee, it sounds like you might have been involved with that prior to the pandemic. Was that just a kind of a coincident timing where you started doing that, and then the importance of hand hygiene went up exponentially as the pandemic hit?
Yeah, and what's funny? I joined Stony Brook. It was my first academic job after a fellowship, really, and I started here roughly June of 2019, and then November is when the first cases pop up in Asia, and then of course after that it all snowballed from there. So I never expected to become an attending right at the beginning of a pandemic. I had joined the hand hygiene efforts shortly before all of this started happening. I think it's such an interesting situation because we know all the way back to the 1800s that something as simple as using an alcohol-based sanitizer protects not just you, but also your patients. It's been well known, well documented, and even, there's been studies on this, the CDC has published them, where hospitals that have higher rates of compliance with their hand hygiene, their hospital-acquired infection rates go lower. As the rates of compliance go higher, the rates of hospital-acquired infections go lower. And I think the pandemic just brought this really to a very, it put it on the spotlight. With the pandemic, there were additional elements such as the eye protection, the respirators, and so on and so forth. But yeah, it's I think a lot of people all of a sudden realized, yeah, we should probably be paying more attention to this.
The message is probably more critical to them now than it was, because they're not only worried about passing it along to other patients, but to themselves and to their family.
Absolutely, and I think that's actually a very good reminder for all our staff that it's not just COVID-19 that if you don't perform this, it may prevent you from taking that back to your family. But also, we work in a hospital, therefore we're dealing with a lot of sick folks here and a lot of multi-drug resistant pathogens, and this really reduces your risk, not just of passing it along to your patients, but also bringing it back home with you. So yeah, definitely has been brought to the forefront.
And then you had mentioned that you've gotten your immunization, which isn't surprising. You've gotten your vaccines. How has your behavior changed after you got your second vaccination? Have you seen family? Have you done anything differently? It sounds like you're not traveling. Are you doing anything differently than you were before you were vaccinated?
So, yeah, we were lucky enough that, for example, my in-laws, they also they're older, so they also received their vaccinations, and we were able to visit with them, and that was wonderful because it had been over a year since we had seen them. So we also, it's sometimes it's just peace of mind. Like when we go to something as simple as a grocery store, we still wear a mask. We still have the what do you call it, alcohol sanitizers, and the multiple of them in each of the cars. We still like to, do a little bit of, if there's a Lysol or whatever product swipe, we like to clean the little card, market card, whatever it is. So a lot of those items we're still careful with. It's just a lot of peace of mind to go there, to know that you can be there and not be quite as, looking over your shoulder. Am I keeping enough distance from everybody else? So, and the most important part, I think, has been the ability to visit with family.
Sure. And I have to ask you about your degree in classical guitar performance. How did you go from strumming to infectious disease?
Right. Yeah, that was quite a what do you call it? Quite a trip, I have to say. I actually moved to the U.S. to get my degree in guitar performance. I was born in Mexico. I became a naturalized citizen later on, but I think it became. I never. How some people know when they're young, when they're even sometimes before high school, I want to be a doctor. That's it. I know that's the path for me. That was very far from being me. I obviously started with music, and then just along the way, I realized that I love it. It's a wonderful path. I wanted to be part of something even larger, though, and I think the wonderful thing about medicine is it takes you out of yourself. With music, it's amazing. It's a huge part of the human experience. In a way, you are a little bit locked in your own head and your own emotions. With medicine, it kind of takes you out. It makes you take care of others, and it makes you think of other things that are happening outside of yourself. So in my mind, it took a while to get there. I did a number of things after music school. I was a performing musician for some time. A number of other jobs. Eventually was able to work with several nonprofits. I was very, very lucky with that. And through the nonprofit circle, I eventually landed a job at the medical center at UCLA, actually. And that's where I met a very, very good friend and mentor. I call her my friend-tor to this day. And she was very, very key in, helping me shape the path to where I am now. So I just feel incredibly lucky to be part of the profession. We've had some dark days, like everybody else has. I mentioned Elmhurst. I mentioned a lot of the hospitals in the city, and let alone the rest of the country and the world. There's nothing else I'd rather be doing, though. It's a privilege.
If you wanted validation of the importance of your decision, I would imagine the pandemic provided it. I mean, in terms of your expertise and the importance of it, it's important generally, I would think, but now infectious disease experts are at the center of the universe. I mean, you are what you're doing, your knowledge, your expertise, your ability to help and distill information for others is critically important, and for hospitals, for the community. So, not that you needed it in the context of the pandemic, but I would imagine the pandemic probably, put you, in the epicenter of what was going on.
It's and we also are very thankful. And I have to say, you mentioned the importance of infectious disease, and of course, yes, but I have to give kudos to emergency room, to critical care, to general medicine floors. I mean, it's they were, and not to mention, this is a group that often goes unpraised, and they really should get a lot of the credit. Nursing staff, folks who, even the persons who bring the meal trays to the patient's room. I mean, it's a team effort. It really is a team effort, and without every one of those parts, we would not be where we are. So I'm just very, very thankful.
One last question unrelated to medicine. Are you still playing guitar on the side?
A little bit, as much as I can. Not a lot of time nowadays, as you can imagine, but as best as I can, yes.
Okay, good. Well, thank you very much for the time. We've been speaking with Dr. Miguel Saldivar, and good luck with the rest of this and with communicating the messages that you've been trying to communicate as far as the safety of the vaccine.
Thank you so much. Pleasure to meet you and pleasure to be here.